My name is Rev Dr Eunice KapwaWF. I am a Nigerian American. I am a graduate of the Claremont School of Theology. I am married with 8 kids, 4 biological and 4 step kids. I live in Nigeria as a country of residence. I am a clergy with the United Methodist Church. I have served in the church for more than 20 years. In addition to my calling as a clergy, looking at what is happening in the world today, to have a passion to my pastoral ministry and extension ministry of what is happening around in my community. I have seen a lot of drug users, drug dependents, and as a result of that, there is a lot of crime, premature death, dropout young men and women, and also the crime rate is getting higher by the day. A lot of violence against women, prevalence of rape, and there's a lot of insurgency everywhere in Nigeria. You can read it and you can hear it over the news. And the core of most of this problem is drug use. And when I saw that, I asked myself, how do I contribute to this hoarding world that I can bring a change and transform the life of others? And also looking back at where I came from a family that were using drugs because my father was a drug user. He was an alcoholic. He died as a result of that. And that also served as an influence to my passion to reach out to young addicts. So I started this program, an NGO that will help in reaching out to many that can make a change in the community in which I live. And that is why I decided to establish an NGO in 2018. And the name of this NGO is Kapwa Wholeness Foundation. Kapwa means God. Wholeness means whole as in health, and it's a foundation that I remember my dad and my siblings who have lost their lives as a result of drug use. And that is why I came with that idea of establishing an NGO that will make a difference in the community. And the vision that I have for this NGO is wholeness is worthiness. That is helping young people to live a drug-free life so that they can be better leaders of tomorrow. They can also improve the quality of living in their community, and there will be good governance. Good governance in the sense that the community will have healthy leaders that will offer healthy services to their people. And once we have this kind of young people that are vibrant in our community, that are healthy and strong, a lot of things will change for the better. And that is why I decided to look at this NGO in the areas of reaching out, not just reaching out to those young addicts, but also changing the understanding or the mindset of the community, especially the parents of these young people. What are some of the areas that we have added value to? When we started this organization, what came to mind is how do we make the community understand that illicit drug use is danger and is also destructive. We decided to start with advocacy work. I started this work by reaching out to all the churches around and also to most of the mosques and Islamic schools where women and young women are being taught how to live a good life, and the church where the issue of drug use is stigmatized and is also looking at it as moralism. Whereas people didn't know that the use of drug is a disease. Once a young person has indulged into illicit drug use, he is sick already in the mind. We also a lot of advocacy, a lot of awareness, and a lot of teachings, especially for them to understand the need for us to put our heads together to help the young people that are coming up in our community. We also reach out to schools because that's where the bulk of the work is. Once we educate them right from schools, that's secondary schools or primary schools, we are saving a lot of lives. So we did a lot of educational piece with schools around in Adamawa State and beyond. We also came up with a program last year, and we tagged the program as Let Health Reign. And we look at it from the angle that if every young person growing up is healthy without using drug, a lot of things will change in a community. And what are those things that will change? Crime rate will reduce, violence act will reduce, HIV and AIDS will reduce. A lot of the issue of insurgency will come to be at minimum, because most of these acts that are happening, the vices that are happening in our community is as a result of use of drugs, because none of them in their right mind will indulge into all kinds of crime and especially violence under the influence of drugs. And there are a lot of positive responses from the community looking at what we did and the amount of input that our students have come in with dramas. They have come in with a lot of good messages for their counterpart or their colleagues should be able to understand the language, should be able to understand the impact, the negative impact of the use of drugs. So I want to tell everybody that we have made a lot of achievement because the rate of substance use in our community has dropped. Initially, it was 8 out of 10 that were using lots of substance. It can be tobacco, it can be alcohol, it can be some kind of neuroactive drug, because there are some cheap drugs that they use at a cheaper rate that makes them high. And some of these drugs that makes them high are some socially accepted drugs. What are some of these socially accepted drugs? Kola nut is a drug and is socially acceptable in Nigeria. And also alcohol, all kinds of alcohol is socially acceptable and is being used in all kinds of celebration, and especially during festive period. A small child at the age of 3 can use all kinds of alcohol or some herbs that will make them high. Formaldehyde is one of those things that they use and is everywhere. Young people are using to get high, and it's causing a lot of challenge for us. And in addition, we are looking at the angle of relapse, because there is no quality recovery group and there is no quality recovery family support system that is in place that will help people that have already were able to get a little bit of assistance that can be able to keep up with the recovery process. So most of them relapse. These are all challenges that we are faced with. And I want to tell you that we have put Narcotic Anonymous in place, that we are helping all these young people to go through this recovery process, and it has been very helpful. And what are some of the things that we need in order to make this NGO viable, effective, and also to reach as many young people as we could? We need a lot of financial support. For us to even travel around, need a lot of money for us to travel and to do the advocacy work, and for us also to reach out to schools more. We need transportation. Means of transportation is another challenge that we have. We want to go out into so many different places, but we don't have means of transportation. So that one is also a need. And also, in addition to what we do, reaching out with young people that are drug dependent is also feeding the hungry. There is a lot of problem with poverty, lack of job. A lot of people indulge into alcohol use due to hunger and due to idleness, and most of them don't even know what to do. So they follow their peers, and through that they get themselves indulged into the use of drugs that has caused a lot of harm. So we also provide food items. We also provide skill acquisition for them to be able to have a life that is better for them, and also to have something that they can be self-reliant with. So skill training, feeding the hungry is another additional responsibility for this NGO, and we are doing a great job with that. From 2020 to 2021, we have fed more than 300 people, widows and orphans in our community, and most of them we offer them food items, provide them with a skill sewing machine, and we give them 70%, and we also pay the 30% of their machines that we offer to them. Some of them that cannot afford, we give them free sewing machines so that they can have a job, a self-reliant job that can give them something, so that we can be able to have young people that are not idle, that they can be able to fend for themselves. And also some philanthropies that have a little bit of money that they can invest in our organization. It's not much, but we have been judiciously using some of these funds to be able to transform life for Jesus Christ. So I think some of these things that we do has impacted so many lives. We're able to rehabilitate 25 young men and women that are now going through recovery program. And then at the moment, we are seeking for people that can be able to assist us financially if they could, and also with food items, that we can be able to reach out to as many as we can. And also one of the need that we need a facility like a rehabilitation center. Since last year, we've been hoping that we can have a rehab center, but we are still working on it. We are also reaching out to so many people that can help us do that. We have put the system in place. It's for us to have a facility that will be able to give them quality treatment. It's not easy, but we believe that it's doable. And with your support, with your kind generosity, all these things will be put in place, and a lot of lives will be transformed, a lot of life can be saved, so that we can save our young, vibrant youth from premature death and from being crime victims, being in a wrong place at the wrong time. If we can put our heads together, we can do fabulous things. There are a lot more we are doing through this organization. If you have questions, don't hesitate to call my number 08030751310 for more information. We will be glad to give you detailed information that will change the life of so many youth. Thank you very much. May God bless you. Rev Dr Eunice Ilia.